Welcome, everybody. Hopefully you can hear me. Welcome. We are happy to have you join us today for our Living with Peripheral Neuropathy seminar, question and answer session. My name is Nancy Froman, and we get started. Before, just a few housekeeping notes before the beginning of our presentation. We will be recording this presentation. You will get an email probably tomorrow with the link to the presentation so you can see it again. We'll also have it on our website. So you can view it at a later time. If you have any questions, please feel free at any time during the presentation or during the session to write them into the question box, which you'll see on your screen. We will be sorting through those and try to get through as many as we can. The questions we can't get through, we'll try to follow up later on. To introduce us, my name is Nancy Froman. As I said, I'll be managing the questions and answering some of the back end of our discussions during this session. I'm also joined here with my colleagues, Tanya, who is doing the tech part, and Lindsay Colbert, who will be moderating, and you'll see her on screen during our discussion with Dr. Patterson this afternoon. And then finally, I'd like to introduce Dr. Shanna Patterson. She's assistant professor of neurology at Mount Sinai West, and we're privileged and honored to have her as our FPN patient advisor, and she will be here to answer questions, and I'm sure we're in for an enlightened discussion. So with that, I'm going to welcome Lindsay and Shanna on screen and kick off our session for today. Thank you.
Hi, everybody. I'm Lindsay Colbert. As Nancy mentioned, I'm the Executive Director of the Foundation for Peripheral Neuropathy. Again, thank you so much for joining us today. Dr. Patterson, thank you for your expertise.
My pleasure. It's always really wonderful to be able to participate in these events. Thank you for having me.
Good. Well, let's have a nice, fun hour. There's a lot of questions already coming in, but I kind of wanted to address the elephant in the room, which I've been curious about on behalf of the organization and patients is, should patients who have peripheral neuropathy get the new COVID-19 vaccine? Is that something you are recommending to your patients?
So I think, there's a lot of different levels to this. There's obviously a lot of different types of peripheral neuropathy, and there's right now one vaccine, but perhaps within next week we'll have another FDA vaccine and more in the pipeline. So I think there's a lot of nuances, but the overarching recommendation is yes. I think that we really are seeing that, one of the big equations that we're taking into account across the board with different types of patients is really what is the risk of the vaccine for a given patient versus honestly what is the risk of getting COVID itself. And in all but very, very few situations, we think that that equation clearly weighs in favor of getting the vaccine, even if there are some unpleasant side effects that last a day or two for a small percentage of patients who receive the vaccine. I think that, one of the clear, clear kind of warnings that we are putting out there and asking patients to discuss with their physicians in advance is if you have a history of severe, like anaphylactic allergic reactions, especially to other vaccines. And you can see, this is a very relatively small number of individuals, but if you happen to be one of them, and that's really independent of whether or not you have neuropathy, then we do encourage you to speak to your physician. But interestingly, even for patients who have other types of neurological autoimmune diseases, we are seeing organizations come forward. The American Myasthenia Gravis Foundation put out a statement recently, really encouraging patients overall to receive the vaccine.
Good. Well, thank you for that. We've had a lot of patients starting to ask questions about that, and that's something that I also want to make sure that I'm giving the appropriate advice on. So thank you.
Absolutely.
We have a lot of, yes, we have a lot of broad topics that I want to cover today and questions within each topic. So I wanted to start right now with nutrition. In your opinion, what are the best and worst foods to eat for someone who has neuropathy?
So that's a really interesting question. I think, though we certainly recognize that diet nutrition is really, really important, just a caveat before we launch into this, there unfortunately is no dietary or otherwise kind of cure-all for neuropathy. But certainly we recommend that patients eat healthy diets, really whole foods, avoiding processed foods, nutritious foods that are rich in vitamins, naturally occurring vitamins and other nutrients. I think that, depending, this is kind of an interesting, point, but for some patients with neuropathy, they may be prone to dizziness. So paying attention to hydration is really, really important. I think that, the days can fly by and maybe we've had a cup of coffee. And interestingly, something like coffee or other caffeinated beverages or alcoholic beverages can actually be dehydrating. And so it's really important to kind of pay attention to your hydration status and make sure we're getting lots of fluids as well as other healthy foods. Clearly, for any patients who have diabetic neuropathy in particular, we also, of course, want to be very mindful of eating a diet that really helps with bring the glucose levels under good control. And I think that, depending on the patient, there may be different levels to that, which is something that hopefully you're able to discuss, if not with your neurologist, then with your endocrinologist or primary care provider who's helping you with your diabetes.
So are there any diets in general that you know that might slow down the progression or perhaps decrease the pain or reverse some of the symptoms that a patient might feel from peripheral neuropathy?
So when we look at, making kind of medical recommendations, there's, like with vaccines, Diabetic vaccines, there's different levels of what we call evidence or proof. And, the most rigorous are different types of scientific studies. And then there's, at sort of the least rigorous end of the spectrum, there's a lot of kind of anecdotal discussions out there where patients do something and they say they feel better, but there's never really, and we think we might have some ideas why that might be, but we don't really have any scientific studies to kind of back that up. So we do not have any scientific studies, that are like really kind of large studies or placebo studies. It's obviously harder to have a placebo controlled study when you're talking about diet because most of us know what we're eating. But when, I think that some patients feel like they notice improvement with some of these so-called anti-inflammatory diets. Usually, interestingly enough, these diets involve low sugar, low, very, very low kind of refined carbohydrates overall. So not eating pretty much most breads, or crackers or other things similar to that. Some patients do notice a benefit with that. I think that, we don't, again, have really hard and fast scientific evidence behind it, but the theory is that this may help reduce inflammation in the system and may help with neuropathy symptoms overall. Though not one of the most common causes of neuropathy for sure, but I think that for any patient who has undiagnosed celiac disease, which can also be linked to neuropathy and lead to certain types of nutritional deficiencies, avoiding gluten is a huge factor in terms of improving your overall health, but including any neurological complications such as neuropathy. However, if you notice that you think you might have celiac disease or gluten sensitivity or gluten allergy, then it's always important to really see a specialist in that area and be diagnosed formally.
Okay. So what I'm hearing is eat healthy, right? But at the end of the day, we also we're kind of interested in always taking supplements, right? Just in case you don't get something in your diet. So again, with your lens on as a neurologist for peripheral neuropathy patients, are there any supplements that you would recommend a patient look into or ask their primary care physician about? And then similarly, when talking about supplements, you also have to be worried about the dosage as well. So could you speak a little bit more about that?
Sure. So, I think that one of the interesting things about supplements in contrast to prescription medications is because they're not regulated in the same way, you can find a lot of variability and a lot of things that are available for sale that may not have the benefits that they're kind of claiming they have. So I think it can be for anybody who's out there looking and doing research, it can sometimes be very confusing. So, a few things I would say, again, getting back to like what we know for sure from a real scientific evidence perspective, we know for sure that there are certain types of vitamin deficiencies and a few vitamin toxicities that clearly can cause peripheral neuropathy. And for any patient that we suspect might have one of these issues, we can easily measure these vitamin levels in your blood and confirm whether or not that vitamin is deficient. So for example, vitamin B12 deficiency or vitamin B1 or vitamin B6, these are all examples of vitamins that if deficient, they can cause peripheral neuropathy. And so these are some things that many of you may have had checked in some cases, by your physician as part of your evaluation for neuropathy. If we find this is deficient, we know that we have to prescribe certain levels and in some cases do other studies to find out why you might be deficient in these vitamins in order to kind of address this. If all of your vitamin levels are normal, and if there's no real suspected nutritional deficiency, then if we really look strictly speaking at kind of the scientific, studies in terms of like randomized controlled studies, there's no real evidence at that level to show that taking supplements otherwise is a broad spectrum kind of must do for neuropathy patients. Now, that being said, there is a lot of literature out there discussing that some people do feel better. And then there's, again, some of these, especially kind of like these anti-inflammatory and other mechanisms, of discussing even if your vitamin levels are normal, maybe it's helpful if you take extra. This, again, we don't have the most strict scientific rigorous evidence for, but some people do think that it helps them. And sometimes that can include things like B vitamins, omega vitamins, a lot of these anti-inflammatory kind of style supplements. I think that, we're seeing, to be honest with you, kind of a similar thing with COVID, unfortunately, where people are talking a lot about supplements that can help with inflammation or help fight off viruses, whether it's zinc or vitamin D or vitamin C. Again, do any of these really cure the condition? No. But there's some information out there that maybe this, helps in some way. So I think people are doing it. One, because it's easy to get, it's not going to hurt you. And even if it might help you some, it's worth it. So this is somewhat of a similar idea. One big caveat I would have with respect to supplements is this, or two, I guess. One is that there are a very small number of vitamins, which if you have too much of them, they can actually make neuropathy worse. One of those is vitamin B6. And so I think that, if patients, it usually is not the case, but occasionally if you see, we see someone who's taking very high, amounts of different types of supplements, we check the levels and find that some of them are high. Some of these vitamins flush out of your system and it doesn't make a difference, like vitamin B12. If you have a really high level, it actually just flushes out from your system and doesn't cause a toxic neuropathy effect, but vitamin B6 can. This is obviously confusing. And so it's something that I like to just kind of counsel patients on moderation and sort of having that discussion with them. And the other thing I would say is that occasionally patients will come in and they have especially kind of botanical herbal preparations that are not labeled. And then we don't even know really what's in them. And so I think that in that case, it's concerning because we would, in some cases, especially with plant-based supplements, there can be pharmacologic properties for some of these preparations that can actually interact with other medications and have other harmful side effects. So I always just encourage people, if you're taking something, let's make sure it's labeled at least so we know what's in it, so we can look through it. and just having, I think, these reasonable conversations with your providers. But if you do look through, I think that a lot of people, do like taking kind of omega supplements, omega 3, 6, 9 supplements, also different types of vitamin B supplements. And these, again, are things that, may help. And it's always a good idea to talk to your doctor first.
Yeah, I think that's kind of the key takeaway, is to verify some of the levels before you decide to kind of, self-medicate, which is something that we also really stress patients to do. So I'll be sure to continue to encourage everyone to have those individualized conversations. So hand in hand with nutrition is exercise. And do you have any recommendations in general for patients? How much exercise should they try to do on a daily basis or a weekly basis? How long should they try to exercise? And obviously, there will be some limitations with some people's physical potential, but at the end of the day, what do you see as in your patients as exercise helping them?
Sure. So that's it's a really great and important point. And it can be really kind of nuanced at the same time. I think that while we know that exercise itself, may or may not necessarily cure neuropathy, it can make a huge difference. And interestingly, I've seen a number of patients since the pandemic, some of them with neuropathy or other similar conditions, where after really not being able to go out, especially here in New York in the spring, a number of people I saw said, I just feel like weaker. I feel like my balance is worse. I feel like a little more aches and pains. And they really actually noticed a strong relationship between even kind of their basic physical activity and then suddenly not being have that really a low level of physical activity because of the quarantine. So, that is not an experiment that I would recommend, and it's something that we hope will go away very, very soon for everyone around the country. But I think that it is something that when I think about exercise in general, I think about it as something that really kind of takes everything that's happening in your body, whether it's the nerves, the muscles, the skeletal system, and makes it really as good as it can be. Really keeps everything kind of clicking and cooperating and functioning as best as possible, even in the face of neuropathy or arthritis or something else that may be going on. And so, I think on top of that, something else that we know about just in general in terms of exercise and obesity is that these can also, physical inactivity and obesity and so-called metabolic syndrome can also increase the risk of neuropathy and also of diabetes. So that's one piece. But separately, I would say that in general, of course, especially for neuropathy patients who have any problems with balance, whatever you're doing, I always say it has to be safe. So, if you're trying to kind of run on the treadmill and you find yourself tripping or so forth, this is not the right exercise for you no matter what. But so it has to be safe, whatever you're doing, no fall risks, nothing along those lines. I think that for everybody, kind of some moderate exercise, including like walking, for example, is a fantastic form of exercise, and doing that really as close to every day, if not every day as possible, is really beneficial. If you wanted to get into more specifics in terms of weight training, there's a lot of benefits of certain types of moderate weight training and other things on top of that. And it's interesting because I think we can see that there's different types of official recommendations for all adults that are sometimes being tweaked year to year, but it's always, consistent that getting regular exercise is important. I think that also if you search online, even you can find, especially in these days where our access to classes or other resources may be more limited, you can actually find some fairly high quality sort of links and different ideas for modified exercises. Even looking at exercises for neuropathy, you can find actually different types of forums online that have pictures and so forth. Balance is a really key issue in neuropathy for a lot of patients. And there actually are a lot of different exercises online that you can do at home, even with it using a chair or other simple objects that you may have around the house to help with that. Stretching can also be extremely, extremely beneficial. Many patients have neuropathy symptoms in their feet, and there's a lot of other tissue in the feet that can become tense and painful, even aside from the nerves. And there's a lot of benefit in many cases to making sure we're stretching the feet in different ways and mobilizing them. So there's a lot of resources. There are some books out there, but I think that overall safety is the most important. And then something that's regular and moderate, that you enjoy is really the next important thing. If you're thinking about, running a marathon or something else like that, I might talk to your doctor if that's not something that you're usually doing. But exercise is very, very important.
And to never push through the pain, right?
No. Again, unless you're working
Listen
with
to your body.
Exactly. So I would certainly say listen to your body. And it may not even be during the physical activity, but after, ideally this should be something that really feels good. And so if you notice the next day you feel completely drained and wiped out and you were really pushing yourself, then I would say take a little bit of a step back. In almost every case, if you're trying to build up some sort of physical activity regimen and you haven't been as physically active, it's a gradual process. Yeah. So I would just say be patient, listen to your body.
Great. And you started talking about some symptoms of peripheral neuropathy. Obviously, there are nearly hundreds of various symptoms, and I think it'd be interesting to poll the audience right now, because I'd love to kind of see what symptoms the audience is currently facing. What bothers all of you the most? Is it pain? Is it balance? We have tingling and numbness, burning, freezing pain, muscle cramping, twitching, weakness. I think having this answer is always really fascinating, because we always forget all of the various symptoms that people are experiencing, and be interesting to see who in the audience right now is experiencing what, because then I think we can try to maybe tailor some of our next questions accordingly. So let's keep this poll open another few seconds, so more people can answer. And all right. How about we close the poll? I'm eager to see who's experiencing what. All right, so tingling and numbness. That's interesting. Usually we have a lot more people on our call that experience balance and pain. That's usually the top symptom concerns that we receive here at the foundation. But do you have any thoughts on this, Dr. Patterson?
Yeah, it is really interesting. I think that one of the challenges that we see with tingling and numbness, and it can be really frustrating, is that we talk about certain things as what we say are kind of positive symptoms, meaning that you are at a baseline and then you experience something that wouldn't normally be there, and negative symptoms, which means you would normally experience something but it's diminished. And so numbness, or really, a dead kind of sensation, is what we call a negative symptom. Things like pain or even tingling are what we call positive symptoms. They're sensations that wouldn't normally be there, but that you feel them now. And, I think one of the real challenges with neuropathy symptoms is that with respect to neuropathic pain, we have a number of medications. None of them are perfect, but we have a number of medications that we can use and offer patients to treat the pain. But we unfortunately do not have an effective medication for numbness, or a lot of things in the numb kind of spectrum, like where it's not, patients will say sometimes, it's not really clearly painful, but it feels dead or numb or weird, or, like my foot is in sand or wrapped in plastic, or all of these kind of different, dull, strange, unpleasant sensations. And we don't have a great, medication to take that away and make the sensation normal. And so I think that can be really hard.
Yeah, and I'm seeing a lot of questions coming in right now, or comments based on the poll, that patients experience not just one of those, but actually all of them. And unfortunately, and I apologize, the poll only allows someone to select one. And it obviously doesn't include all of the symptoms that one could have. So again, apologies for that, but what can someone do to help then the numbness or the balance for that matter? What would you tell a patient that says, hey, I have numbness and I have tingliness or loss of balance? What would be the next steps? Is there a medication? Is there something that they can do to help kind of mitigate those symptoms?
Sure. So I think, first of all, just going back to the very beginning, if this is a new symptom for you and you haven't had a workup for neuropathy before, please speak to your doctor about getting that done. Or if you feel like, oh, gee, I think I have symptoms of neuropathy, I probably have neuropathy, please see your doctor, because it can really be helpful to look at and seeing if there can be really answering the question of why that is. Because in some cases, once you identify the cause, peripheral nerves can actually regenerate in many cases. And so having, if we identify a vitamin deficiency or thyroid imbalance or diabetes, treating the underlying cause can actually help stabilize the neuropathy. And depending on the type of neuropathy, it can actually start improving over time as the nerves regenerate. So don't discount that part of the process. I know it's not the focus of the question, but please make sure that that's taken care of. Once that's taken care of, and then we're really looking at symptom management, which I think is important at every step of the way, and it's always a part of the conversation. So I think with respect to balance, usually there are certain types of more common scenarios where people will notice that their balance is not what it should be. And, when we think about balance as a sense, this is a multifactorial kind of issue. We use our vision to help with our balance. There's certain inner ear structures that help with our sense of balance. And we also use the sensation of the ground underneath our feet. And so when you have neuropathy and you have reduced sensitivity of your feet, it really kind of takes away one of those modalities that we use to sense balance. And then as soon as, the most common situation is that as soon as we take away one of the others, then it really, things really get thrown off. So for example, darkness or uneven surfaces can be big culprits. People will notice sometimes when they're washing their hair in the shower, when they close their eyes, that suddenly they feel really off balance. And that's because usually we would rely in that moment on the sensitivity of our feet. And if that's not there, then you can really suddenly feel like you're not sure what direction the ground is in. What I, like to recommend to people is, one, know kind of what some of these tricky situations might be. Try to notice, for yourself, what are the situations, what are the moments where I notice that I'm feeling, usually off balance? Is it changing positions quickly, turning quickly? Is it getting up in the middle of the night to go to the restroom and trying to navigate in the dark? And then sometimes you can look at really simple behavioral tricks, whether it's turning on the light, getting a bar to hold on to in the shower, other things like that. Occasionally, I will say, if people want to go out, and walk around and it's, maybe sidewalks are uneven or something along those lines, even though it is oftentimes a difficult transition, I will encourage patients 100% to think about getting a cane or even a walker, even if you're just using it sometimes. If you have significant balance problems, or if you feel like you've almost fallen or because of this, or you have had falls in the past, because nothing is worse than falling. And so I think that, having this even just as a backup for safety, for balance, if for some patients, is important. And then I think separately, getting back to the exercise question, there's a lot of balance type of exercises that physical therapists often do that you can find descriptions of online that can be very, very beneficial. And a lot of this has to do with practicing balance at home, which you can absolutely do using kind of holding on to the back of a chair, standing in different positions, standing on one leg at a time, and so forth. Shifting to some of the other symptoms you mentioned, I think with respect to anything that's pain or even uncomfortable tingling that may not be frankly painful, but that is uncomfortable. Sometimes the neuropathic pain medications can be helpful. These can include topical agents for some patients who don't want to take pills, and there's a variety of medications that can be useful. I think one of the positives is that we have a variety of different choices. And so it's always a balance between finding what works for any given patient without causing more side effects. So it always is a trial and error process, and we just partner and go through it. And the last thing that I would say is that sometimes patients will reflect and notice that there's different situations that make the symptoms worse. For some people, it's wearing certain types of shoes or tight, fitting shoes. For some people, it's temperature, or sometimes it's like going barefoot over hard surfaces, like in the house. And I think noticing any of those things and making modifications can be a big benefit.
Thank you. And I know you touched on some of the pain medications. Obviously, gabapentin, Lyrica, those are very common ones. And a lot of our patient population are just curious, what else is there other than those two giants? Are there other things? I mean, especially for people that say, I've tried gabapentin, I've tried Lyrica, they don't work. I need something else. Is there something else that's out there that is kind of popular and maybe a little bit different that might work?
Absolutely. So I think, gabapentin is probably one of the most common medications that many people have heard about. What's interesting about most of the medications, if not all of them that we use for nerve pain, is that these were actually usually initially designed for other types of nerve conditions, like even depression or seizures. And then later people do studies and identify, oh, this actually helps with nerve pain as well. And some of them are, the way they act on nerves is a little bit different. So for example, things like gabapentin and Lyrica tend to act on nerves in a way where they sort of dampen down transmission of nerve signals in some ways. And so we think of them as like dampening down nerve pain. For some patients, they can cause them to feel a little bit lethargic as a kind of a normal or expected side effect. But if your symptoms are more bothersome toward the end of the day and you're trying to go to bed, that's not necessarily a bad thing. And for some patients, they even welcome it. There are other medications, many of them which were initially developed as antidepressants, which people can use for neuropathic pain. One that people may have heard of is called duloxetine or Cymbalta. There's some other related agents, or another agent called Elavil or amitriptyline. And so I think that, for some patients, these are a better fit. They tend to have fewer, some of these, not all, some of them tend to have fewer sedating side effects. And so it's just a matter of finding like the best fit for each patient, looking at what their other medical conditions are, what their other medications are, looking for interactions. There are also some exciting topical choices. Topical capsaicin patches are actually a relatively new option that we see. These are capsaicin is actually sort of a chemical compound that's found in certain types of hot peppers. And it's been found to sort of interrupt or scramble, if you will, some of the pain signaling. And so it's applied topically by a medical professional because the compound can be so irritating. It's not something that is available to patients to do really on their own at home. But this can have lasting benefits for a number of patients. And there are other kind of sort of types of topical agents that have been around for a while that may not be as robustly effective, but for some patients who need just to take the edge off a little bit and don't want to take a pill, even certain types of topical numbing creams. I know it's not ideal because if numbness is a big problem, then this, it won't make you feel normal, but if it's kind of taking the edge off of pain and it's really focused over your feet or other areas, topical agents can be beneficial. Compounding pharmacies also can make things like gabapentin that's compounded into creams and so forth. This is a little bit harder to find, and oftentimes it's not covered by insurance, but you'll hear about these things as well. People often talk about, like, what about medicinal cannabis or marijuana is a hot topic. We really, it is something that people are looking at for pain. We really don't have kind of a clear 100% green light benefit relative to some of these other agents. I think part of this is the limitation that we have now with medicinal cannabis research, just because at the federal level, it's there's not as much availability to get funding across the line. And that's the same kind of, I think, some of the issues with insurance and so forth. So I think that hopefully in the future, once we have more standardized pathways for researching cannabis and standardizing compounds and doses and formulations, we'll be able to get a better sense of this. But right now, there's so much variability. Some patients will swear they found a topical CBD oil or something like this that they feel like really helps them, or that they're using medicinal cannabis and it really helps their nerve pain. And some patients say it does nothing, or it just makes them feel bad. So it's a little bit of, I think there's a lot of different things happening in that field now. For some patients, acupuncture really helps. It's often a transient benefit, meaning it's not kind of permanent and they may need to go back for repeated sessions. For some patients, massage helps. I think, these days during the pandemic, people are finding a lot of these kind of different devices where you aren't going out somewhere else. So people sometimes will find like little kind of home, things you can soak your feet in or massage your feet or put your feet on top of them. And for some patients, these can be really beneficial as well.
Yeah, and you'd also mentioned sleep. And obviously here at the foundation, we hear so many patients that say that their peripheral neuropathy affects their sleep. I would love to poll the audience to kind of get a better understanding of if that's affecting the people watching right now. So stay tuned for that poll. But Dr. Patterson, could you just briefly talk about sleep and why do symptoms possibly get worse towards the end of the day? Why does this happen?
Sure. So it's a very, so clearly neuropathy itself doesn't change depending on the time of day. It's not that the neuropathy is actually worse at night during the rest of the day, but it definitely can feel that way. And it's a very common experience. I think, there's a few different things that people have thought about with respect to this. One is that oftentimes our body temperatures change actually later in the day, or our feet may be in particular in cooler environments as we take our socks and shoes off, or maybe enjoying kind of laying in a cool bedroom. And people do think that temperature may play a role in this to a certain extent. So some patients find that wearing warm socks to bed or using a heating blanket or something like this can be beneficial, or soaking their feet. The other thing that I think we sometimes think about is that just the fact that you're maybe relaxing and unwinding toward the end of the day, and as opposed to like during the middle of your afternoon or your morning when you may be focusing on a variety of different things, or having, people speaking to you, or on a Zoom call, or checking your email, or doing other things, that when you're laying there resting and just trying to relax, if there's
something, you're not distracted.
Exactly, you're not distracted, and it may be something that may have been kind of irritating but not like at the forefront, may suddenly become really, really annoying, especially when you're trying to relax and go to sleep. And so and then I think, something else that I was reading about that I think is very interesting is the concept of pain and sleep and being tired. And people always talk about, oh, it's important to get your rest, and it sounds kind of trite, but it's so true. And being tired and not well rested can certainly, I think, people's subjective experience of pain under those circumstances is heightened. And then it's an awful feedback where, then it's even harder to fall asleep. And there's a lot of different things going on there.
Mm-hmm. Yeah, and I apologize, the poll didn't seem to stick. So, but yeah, I think in general though, that people do have more of their symptoms feeling during sleep time, and that's when you find it most aggravating, because all you want to do is just kind of let everything relax. So so yeah, I know it's very common, and it's just something that hopefully people can figure out. And I'm trying to figure out if we can still get this poll launched, but oh, here it is.
Great.
Yes. So sorry. So yeah, so we've already talked about this, but I'd love to still kind of get a little bit of an understanding if symptoms are worse, if they impact the sleep, or if you're one of the lucky few that don't see any impact. All right, let's go ahead and close out the poll. I'm interested to see Also, it makes me see that nobody's actually sleeping during this presentation. All right. Okay,
Yeah.
so they do affect sleep. Sometimes they get worse. So yeah, it seems not as high as I think I was expecting, which is great.
Yeah, absolutely. But I think, looking at my symptoms are worse at night and the symptoms affect my sleep, assuming that people can only vote once, that's still like 3/4 of the respondents, which is really interesting.
Yeah.
And I think that, looking here and seeing that, between 3/4 of the people who responded to this poll, it either affects their sleep, or if it doesn't affect their sleep, it's still worse at night. This is, I think, why, for those patients, sometimes some of these medications like gabapentin or Lyrica or others that may also help relax the nerves in your brain, frankly, and
Yeah.
kind of help you get to sleep as well as helping the pain. Sometimes it can be a nice kind of double benefit.
Yeah, and there's a few comments that are coming in live right now saying, yes, awful pain, it used to be unmanageable, and other people are saying, hey, that's actually when my pain or my symptoms are at the least height is when I sleep. So I think, to your point, it might also have to do with some of the medications that someone might be on and how that might be helping manage that symptom, especially during the night. That's great. Well, we're getting a lot of questions about various treatment options, and I want to be mindful of time. So briefly, what is your advice on IVIG? Is it
So
good? Yeah. Sorry,
yeah.
no, go ahead. I was just, I think lots of people are just curious. IVIG, is that something that someone should give a shot?
So IVIG is a really amazing question because it's getting a lot of attention now. And I think, when you read online, there's a lot of different discussions about IVIG and what the benefits might be for IVIG. And I think that, when we look at what IVIG does, it really is this IV immunoglobulin that helps modulate the immune response in some ways. So it's used in a variety of different immune deficiency syndromes not related to neurology, and it's used in a variety of autoimmune conditions within neurology. So I think, when we take a step back and we say, okay, what was it initially kind of designed for or approved for with respect to neuropathy? It really is the autoimmune, some of the autoimmune neuropathies, like
Okay.
CIDP would be one of like the most classic responses.
Okay.
If we know that the neuropathy is related to diabetes, IVIG really isn't going to be a treatment, or if we think the neuropathy is related to chemotherapy effects, unfortunately, IVIG is not going to be an effective treatment. I think that, what we're seeing now is that because I think there's so much attention on inflammation and other types of immune system sort of spectrum disorders, people are wondering, well, what if,
Yeah.
what if I don't obviously have CIDP or one of these other autoimmune neuropathies, but what if there's still an autoimmune kind of component? And that's where I think a lot of these questions and some new research areas are coming up. I know that Ann Oaklander is often cited researcher at Harvard whose field focuses on small fiber neuropathy. So this is the type of neuropathy that's detected using skin biopsies. And some of her research is supporting, what if we have small fiber neuropathy, which many cases are idiopathic, meaning we can't find what's causing it.
Right.
And she's posing, what if those cases and some are actually autoimmune? And then she's looking at IVIG for treatment of those. Part of, I think, in practice, some of the frustration is that insurance companies are not approving this for the most part until we really have FDA approval and larger studies. So in some cases, there are patients where we say, yes, there are some papers here, it does look interesting. And then we, in some cases, it's really hard to get insurance approval. So I think we're in a real transition zone. I think the interaction of the immune system on many, many different organs is fascinating and something that we're still learning so much about.
What about TENS units? What are your thoughts on that?
So TENS units, and there's actually other, different types of related sort of stimulation units. are fascinating. So on the one hand, TENS units in particular, what they do is they deliver electrical impulses that actually cause kind of a buildup of tension in different ways, depending on the setting, in the muscles. And so they kind of, and you can feel this if you have ever used one, you can feel like your muscle kind of contracting in a way on its own, and then the relaxation of the muscle after the stimulation goes down and the contraction goes down. The I think some of the things to think about is, one, I think that this can be sometimes impactful for neuropathy symptoms, especially I think for some patients who find that like an interruption of the sensations helps. There's kind of this different, I think there's so many things, as we saw here in the respondents, there's so many, I'm sure if we did like a word cloud type of response, we would get, and that might be something interesting to think about for the future, it would be like an interesting whole array of different descriptions of what the neuropathy symptoms feel like, whether it's burning or tingling or stabbing or other things like this. The transmission of pain and the perception of pain is another field. As much as we think we know about it, I think we still have a long way to go to really understand it. But people have thought, what if you interrupt the normal signaling of the pain by sort of distracting the brain in a way with another sensation that actually might dampen down the initial pain sensation? It's not exactly like this, but it's kind of like if you have a paper cut and it's really bothering you, and then someone hits your finger with a hammer somewhere else, a different, you're probably not going to notice the paper cut, as much anymore. So it's not like that exactly, but it's the same kind of idea. It's like a sensory scrambling and distraction. So with TENS units, and actually there's other implantable type of electrical stimulation units that require surgery for implantation that are certainly a whole different level. A lot of them operate using the same principle, that you're kind of interrupting or scrambling different types of symptoms. And I think
what about
patients who have muscle tension or spasm in an area, that they have the neuropathy, the TENS units, because they operate with this almost massage-like muscle kind of action, may also be beneficial.
Light therapy, what are your thoughts on that?
So light therapy, are you meaning like laser therapy?
Laser, yes.
Like on the foot sort of thing?
Yes.
Okay. So I think, that is something that is, I know there's a lot of research on. We don't have a lot of kind of crossing over into the real larger kind of broader scientific arena. For patients who find a device or something that they want to try, my advice to them is, if, we know that it's not harmful, and if it's not going to, cost you a lot of money that you don't have, certainly you can try it and see if it helps you. But it's, I think it's something that we just need in terms of making really broad, medical recommendations as a top line treatment from kind of neuromuscular medical associations. I think we just need more evidence.
Got it. So we've talked a lot about symptoms, about various treatments. We could keep talking about those, but I know we only have about 10 more minutes in the presentation. So I'm curious, as are so many patients, is PN reversible? Can you reverse what maybe you did, and maybe that has to do with the underlying cause, right? So if you drink alcohol and you stop drinking alcohol, then you can reverse the symptoms of the alcohol-induced PN. But that's the big, right? The big question is, can patients who have PN now, maybe tomorrow or in 10 years from now, can they not be a PN patient anymore?
So that's a great question. I think that I think that, in some cases, yes, and we actually have seen this happen. We have, papers that describe this. And then in some cases, the answer is really, we don't expect all cases to reverse. There actually are some exciting studies with small fiber neuropathy patients looking at the nerve abnormalities under the microscope on the skin biopsies. And they can see that actually for patients who had maybe borderline diabetes or metabolic syndrome, and then had a dramatic kind of change where they were no longer diabetic or had, become more physically active, and all of their different physical parameters, whether it was kind of obesity and other things, improved, that the nerve fibers actually improved, and they could see them, microscopically. So I think we do know that if you can identify if it's a reversible underlying cause, And if the damage essentially to the nerves is not sort of beyond repair, so to speak, that yes, there can be a reversal and improvement. But I would say that even for patients where maybe there's such significant or such chronic neuropathy that we don't expect there to be reversal, you can still oftentimes, if you identify the cause and really can address it, you can oftentimes even stabilize the neuropathy,
So there
which
is a way
is beneficial.
So there's a way to stop it from progressing in some cases.
In some cases, I think one of the most challenging types of neuropathy, as people discuss, I'm sure, and people listening are familiar with, is what's called idiopathic neuropathy, which means we can't identify the cause. And that can apply to a significant percentage of patients with neuropathy. And that's frustrating because people can say, well, how do I know what to expect if we don't know, or how do I know what to do if we don't know what's causing this? I think that, one of the things that large groups of studies have looked at, because there are so many patients with idiopathic neuropathy, that they have looked at large numbers of patients over years to see, okay, let's try to observe and see scientifically, like, what happens over 5 years or 10 years. One of the things that I like to share with my patients that it may not, I think it is a reason for some optimism, is that especially if you've had neuropathy, it's idiopathic, and it's been very stable for a number of years already, that based on the longer term observational studies that they've done, they've seen that many of those patients kind of remain sort of in a similar level of symptomatology even going forward. That would be kind of as opposed to suddenly changing over time. So I think if your symptoms have been kind of at one level for years and years, and you're worried what might happen in the future, based on what some of these studies have shown, if you've had a number of years that have been very stable, probably based on what we've seen across populations, it will continue to be very stable as opposed to dramatically worsening. So I think sometimes that's a cause for hope and some degree of comfort that we can continue to work on symptoms and partner on that. But it can be frustrating. But certainly we do know, especially for causes that we can address the underlying cause, that the peripheral nerves can heal themselves. This is very different than the spinal cord or the brain with like strokes, for example. And so I think it is a reason, for excitement and for hope. And I think it's also a big sort of motivating factor behind a lot of neuropathy research.
So with all this information, pretend you're a patient and you go to someone and they say, hey, I have a cure. What would you tell them? Is that a scam? I mean, because right now we don't have any cures for peripheral neuropathy. That's obviously what we here at the Foundation for Peripheral Neuropathy are searching for. We're, investing a lot of money in research to find more answers, more treatments, and hopefully one day cures. But we get so many people that say, hey, I found this newspaper article, or I went to this special doctor and they said they have this cure and I just have to do A, B, or C. I mean, what would you say to them? Is that a red flag in your head as much as it is in mine?
I mean, I would say yes. I think one of the things that I think there is a lot of exciting research. There are a lot of things where we've said, oh, this might be positive. If it doesn't hurt you, let's try it. But one of the things that I do worry about, especially is the patients who are trying something either that they're spending a lot of money on. When you say the word scam, that's kind of like the financial aspect of that is unfortunately what comes to mind. So if someone says I have a cure and it's free, that's usually probably not what we're hearing. So I think that I'm concerned about patients being financially taken advantage of, and I'm concerned about patients trying something that is potentially dangerous. So we don't have a cure. If you have a neuropathy and it's because you have B12 deficiency, yes, the cure for you may actually just be vitamin B12. If you have neuropathy and it's because you have hypothyroidism that wasn't treated, yes, the cure for you may be actually just taking care of your hypothyroidism. So I think for some of those cases, that's like very specific, but in terms of like a catch-all, we have a cure across the board, we don't. I hope we do someday. And that's, I think, where the foundation's work is really important. But I would be cautious, if somebody approaches you and says, come one, come all, I have a cure.
Yes, good. And that's kind of what we echo to the people that ask me as well, and the people on the foundation staff. I mean, we're very vigilant about that. So it's good to kind of hear that that's also being echoed throughout the industry. And in the last few minutes that we have, I want to ask one question, and it's kind of that, the patients need hope, right? And that's at the end of the day, that's what everyone's grasping at, is hope that there will be a cure one day for their neuropathy. Their treatments will fly out in thin air and just cure them, or at least manage the symptoms a lot better. But what do you see out there right now in hopes for a cure, or what types of research might you want to kind of highlight in our last few minutes here that might present such hope for a patient?
Sure. So I think, one thing, just to take a step back and maybe close kind of a little bit where we began, is that I think, this year has brought a lot of hardship, but one of the things that is probably ending with is a lot of hope in terms of the power of our scientific communities to really, do amazing work. And so I think that, when we look forward into the future and we see, we think about neuropathy, I think that, we can be confident that we have really strong scientific and research teams and pharmaceutical teams that are working on these problems. I think part of the, challenge with neuropathy is that it's not one size fits all.
Yeah.
So, because you have some types of neuropathy that are autoimmune and that impact the outer myelin coating, and some types of neuropathy that are related to different toxins or that maybe target the inner nerve fibers called axons. Some types of neuropathy, many that impact the feet, but some that impact different parts of the body, and small fiber neuropathy. So I think part of it, not dissimilar to cancer in some ways, is that, we use that as a one umbrella term, but when you think about all the different types of cancer, it's like a lot of different, there's not a one size fits all kind of cure, but if you break it down, I think that's where we're probably going to see the most progress. I think that a few things I would think about, like we discussed, the immune system and different inflammation. I think we're seeing a lot of progress on that front. Even, for example, in other autoimmune conditions like multiple sclerosis, there's a lot of attention on an anti-inflammation diet and how that can help reduce inflammation and reduce multiple sclerosis, which is a brain autoimmune disease. But I think, and also attention, I think, to the what we call the microbiome, or essentially kind of the gut, the gut nerve inflammation and immune system interface, which has gotten a lot of attention. Things like this, I think, when we think about inflammation and autoimmunity, they're looking at this across a lot of different diseases. And I think that neuropathy may very well fall into one of those. Even something like Alzheimer's disease, they're looking at, the impact of some of these same risk factors, but looking at, the brain as sort of a nerve and how this impacts things. So I think that furthering our understanding at the broadest level in terms of the autoimmune system, inflammation, I think that we're learning a lot about a lot of diseases, and I think neuropathy will fall into that, same category for a lot of patients.
Well, that's great, and that's hopeful, and I have hope and promise too here at the foundation. Based off of the last 5 years that I've been here, I've seen a lot more answers, a lot more of a better understanding. We have our research registry, which is a biobank. We have so many participants participating in it, so many researchers accessing samples, trying to find those answers. So there is hope. It's just more about, being patient and being vigilant with your own health and your own health care, and knowing that there isn't a one size fits all. So, so thank you so much, Dr. Patterson. I wish we could keep asking so many more questions here. We might try to do some type of follow-up in 2021. So for those that are still with us, stay tuned. We'll keep you posted. But again, Dr. Patterson, thank you so much for your time today. I'd like to pass the microphone over to my colleague Nancy again, who's going to close out the session. And thank you again.
Thank you, and I wish everyone at the foundation and everyone listening a happy and healthy holiday season and New Year.
Stay safe, everyone. Happy holidays.
Thank you. Thank you, Shanna. Thank you, Lindsay. Thank you, everyone, for being here. We appreciate all the questions that came in and all the great answers we got from Shanna. As Lindsay said, we will try to follow up with some of the questions we didn't get to. You will get an email in the next day or so that has a link to this presentation that has been recorded. You'll also get a survey at the end of this webinar. Tell us what you like, tell us what you didn't like, tell us what else you would like to see. This is a bit of a new format for us, the question and answer. So very curious what you think about it. And we will try to do more in 2021. And if you like what you saw, please continue to support us. We'd love to get whatever contributions you can to support our programs, support our mission. And if you have any other questions, feel free to email us. So again, thank you for tuning in, and we'll see you all next time. Bye-bye.